Good morning. Thank you for having us here, and thank you, Yasin, for organizing this event and David for the introduction. So, I'm a medical oncologist, and I've been treating cancer for women for many, many years. I started my training about 20 years ago. So, for the last 10 years, I've been a consultant looking after cancer, mainly focusing on women cancer. So, in my talk later, this is the outline of the talk. So I'm going to talk focusing more on cervical cancer, since Dr. Lan has done a very good job in introducing and explaining what breast cancer is. So this talk is going to be about cervical cancer. What is cervical cancer? How do they present? What sort of treatments we have available? How can we prevent? And what are the screening tests we have at this present day? And he said, he presented in 2015, the number of new cases presented in Vietnam is more than 100,000 in a year. It's a big number of patients getting cancer. What is more important is when he looked at the figures comparing to developed countries, 50% of patients will die of cancer eventually in the developed countries. However, in Vietnam, it's a lot more people. 75% of patients will die of cancer eventually. What is the reason for this? Because most patients here don't see the doctor until cancer is quite advanced. That means when cancer comes, by the time the patients realize it, it's already in stage 4. So patients die because it's no longer curable. If they present early, before stage 4, there's very good chance of survival. As Dr. Lan presented earlier, breast cancer, when they present early, more than 90% can be cured. When it's stage 4, only 20% will live beyond 5 years. A lot of people are dying unnecessarily. This is just to highlight that I just heard about this. He's a very popular musician in this country. He was only 42, and it's very unnecessary that he should die of cancer at such young age. Two things I'd like to point out. One thing is he probably didn't go for screening, so when he presented, his cancer already spread to other parts, so become stage 4, died quite soon after. Secondly, with good treatment, even though stage 4 cancer in Singapore, generally the patient I see even with stage 4 colon cancer, they can live 2-3 years. So they are really, it's quite sad that he should die so young and so soon, highlighting Vietnam cancer in Vietnam. So when you compare Hanoi and Ho Chi Minh City, the top 5 cancers are still recurring the same. Breast cancer, both sides of the country, is the number 1 problem. Stomach is in Hanoi, lung, colon cancer is number 4, cervical cancer, which I'm going to talk about, is only number 5 in Hanoi. In Singapore, it's actually number 10. So, but in Ho Chi Minh City is number 2. We will find out why and what can we do to improve this number so that it's not so high ranking. It should really be way down here. In developing countries, they are high up, but in developed countries, it's usually number 9 or 10. It's not. Again, women shouldn't be having cervical cancer or dying from it. Hopefully in 20 years' time we can eradicate, and I'll go on to explain how we can do that. Where is cervix? So this is the anatomy of the women's body. If we look at if we cut away the skin and look under what is underneath, we have the colon. This is where all the feces will eventually come up. This is the uterus, where the baby is, when the woman is pregnant, that's where the baby is being formed and developed. And the cervix is really at the end of the entrance to the uterus. And then if we cut the cross-section and look at it more detailed, this bit is here is the cervix. A lot of cancer, we do not know the cause of it, it just happens. Colon cancer, we don't know the exact cause. Stomach cancer, we don't know the exact cause. But cervical cancer, we know up to 90% of cases are because of this virus, called human papillomavirus. Because of that, we should be able to try to find a way to eradicate this virus so that women do not get cervical cancer. Other factors that can increase the chance of cervical cancer is smoking, using the oral contraceptive pills, and having many babies also is a risk factor. To elaborate a bit more on what this virus is, as I mentioned earlier, more than 90% of cases are caused by this virus. But it takes, how do we get exposure to this virus? It's by sexually transmitted. So any sexually active women would have a risk of getting this virus. But it doesn't mean that when one gets this virus, we immediately will get cervical cancer. It takes about 10 to 20 years after our exposure to this virus for the cervix to change and become cancerous. So there is a long period where there is a lot of things we can do to stop this virus becoming causing cancer in the cervix. Usually at the early stage, patients do not have any symptoms. That's why screening is important. Screening means to detect something that is wrong before it causes any problems in the body. When it's a bit later, it can cause bleeding in the vagina. Post-coital, so after sexual intercourse, they can the cervix become quite friable and fragile and can bleed easily. In the very late stage, they may feel a big lump in the tummy. That's because the tumor has become so big. And very late stage, when it spread to other part of the body, in the lungs, it will cause breathlessness. In the bones, it will cause pain in the bone. Diagnose cervical cancer, most important is biopsy. Biopsy means taking a piece of tissue from the cervix. 80% of the cervical cancer is this subgroup called squamous cell carcinoma. 15% is adenocarcinoma. And very rarely is melanoma and lymphoma. Both the treatments for each type is slightly different. That's why we need to differentiate what sort of cancer cells they are. Although they come from the same organ, the cervix, but if they are different type of cells, we treat them differently. Diagram showing the different stages of the cervical cancer. Stage 0 is when there's just cancer cells that are, or cells that can eventually become cancer cells. So when it's detected at this level, patients do not die because we can just remove the cells and that's the end of the story. However, stage 1 is when it's just confined to this part. Again, very good chance of surviving, 85% chance of surviving if it's detected at this stage. And stage 2, when they start involved into the vagina, still not too bad. 65% of patients can survive if we detect at this stage. But by the time it's stage 3, it drops quite drastically to 35% of survival chance. This is when it involves the surrounding organ, like the bladder. You may be touching the bladder, touching the bowel in the pelvic area. Stage 4, really very bad news. 70% of patients will survive beyond 5 years. This is when it spread to other part of the body, like the lungs, bones, the liver. If we detect cancer early, so when it's, like I said, if it's just before the cancer cells are formed, it's 100%. If we remove these precursor cells, 100% chance of curing. Stage 1, 90%, but look at stage 4, 15%. That means in 5 years' time, if a woman has been diagnosed with cervical cancer, only 1 out of 10 women will survive. The other 9 will have died of this illness. Whereas if you look at stage 1, it's the opposite way around. Out of 10 women that were diagnosed with stage 1 cancer, 9 women will survive, only 1 will die of it. So the message again is emphasizing on early stage diagnosis. How do we do that? We do it by screening before patients even experience any symptoms. Treatments available, we can use surgery. Usually the treatment of choice to remove the tumor if it's early stage, just by removing the tumor and that's cured. We can also use radiotherapy or radiotherapy combined with chemotherapy or chemotherapy. Usually if chemotherapy is needed, it's usually more advanced stage. So we try to avoid having to use chemotherapy if the patients, hopefully patients are all diagnosed a bit early. So chemoradiotherapy can also be given instead of surgery. So depending on how big the tumor is, where the tumor is, and the options of treatment will be discussed between a group of us to see which is the best plan for them. Here, which I think Dr. Lan does it here daily. And this is recommended for women who are sexually active after the age of 21. And usually the national guideline is to do it 3 yearly until the age of 65. But if one can afford, yearly is a better interval so that we would detect things quicker. But when it's National Health Service and sponsored by the government, then they would only recommend 3 yearly. The other test that we would do is HPV testing. This is the virus that I mentioned earlier. More than 90% of the cervical cancer patients are because of this virus. So if we can detect this virus, we would be watching this group of women more closely as well. Against these 2 viruses, HPV 16 and HPV 18. There is 100% coverage. If a person, before they are exposed to the virus, if they have this vaccination, then 100% of them will be covered for this virus. That means they will not be, even though they're exposed to the virus, they will be safe from catching it. Same as HPV 16, but only 92%. But when we do this, that's why I mentioned earlier, in 10, 20 years' time, we hope to see an eradication if we could vaccinate all young girls before they are sexually active against this virus. And the chances of getting cervical cancer would reduce to almost, definitely less than 10%, because 90% of the cervical cancer is caused by viruses. These are the ways that we think we can do give awareness to the public in order to reduce cervical cancer. So we improve sex education. As I say, virus is transmitted by sexual activities. So if anyone has new partner or more than one partners, using condom would reduce the risk of catching the virus, increase cervical cancer awareness. So some people don't even know where the cervix is, let alone cervical cancer. So it's not something to be shy or embarrassed to talk about. We should increase public awareness, let everybody know that there is such cancer exists, but such cancer can easily be prevented. Increase cervical cancer screening. So again, as I mentioned time and time again, screening is most important because we can detect cells that can potentially become cancer, and remove that, we will not get cancer. And increase HPV vaccination. So this is the best way to eradicate this virus completely. Messages from this talk is that women should not get cervical cancer as it is preventable, and women should not die from cervical cancer as it is easily detected at early stage, and there are effective treatments we have to eradicate this cancer, cure this cancer. Be educated about this cancer. Hopefully in 5 years' time, the cervical cancer rates in Vietnam would drop below